because women who experience the more severe versions have a higher risk of developing coronary artery disease, cardiovascular events like heart attacks, strokes, more likely to develop dementia. So we need to understand that these are symptoms that can be very unpleasant and alter quality of life, but they also are foretelling of risk. It's not destiny, it's risk. That's why, you need to, look at that. And we also know that women who are more prone to developing the worst night sweats and hot flashes tend to have more metabolic dysfunction when they enter menopause. For example, more obese women and pre-diabetic women, diabetic, just women who have unfortunately not been very healthy for a variety of reasons, and they hit menopause. And the way I look at it, you develop through your lifetime your health savings account. Just like for retirement, you want to have your savings for retirement. For women going into menopause, you want your health savings account so that when you hit menopause, you'll be that group that doesn't have night sweats and hot flashes, that doesn't suffer, and actually can do really quite well for a long time. That doesn't mean that you don't age, but you age at a slower rate.
Welcome to I Think I Can podcast. My name is Luella Young. I am a woman who believes that we, like wine, get better with age. Age brings us wisdom, intuition, and a level of sophistication that is beyond the reach of youth. I am here to tell you that living a luxuriously rich and fulfilling life is in your reach. I Think I Can podcast will teach you to think differently in order to get different results. Allow me to show you how to do life effortlessly. This podcast is for the woman who is tired of playing by the rules of society, community, religion, parents, and partners. I Think I Can is all about becoming brave, authentic, purposeful, and strong. Listen weekly and you will find yourself living a life you could have only once dreamed of. Thoughts drive our physiology, so channel your thoughts with me into a life truly worth living. Enjoy the show. So today I have a repeat offender, Dr. Felice Gersh. She was first on the show a few months ago when we discussed the importance of female reproductive cycles in terms of long-term health. So if you haven't listened to episode number 7, I highly suggest you do so. But in this episode, we discuss the importance of hormones past the reproductive years. Dr. Gersh made some excellent points about how to use bioidentical hormones to help women age gracefully. She reminded us that this is no different than repairing the aging process when it comes to such things as cataract surgery, which is seen so commonly in aging, just as a hip replacement would be, or medications that you might be taking to fight autoimmune disease or cardiovascular disease, Alzheimer's, osteoporosis, and breast cancer, all which are a result of hormone loss or imbalance that comes as a result of menopause. So why are we looking at hormone replacement therapy with such a cautious lens? I think it's worth a conversation with your physician who possibly works closely with a nearby compound pharmacy and might be able to educate or offer you the options of bioidentical hormone replacement. Now enjoy the show. Welcome, Felice.
Well, I'm so happy to join you. I came back for seconds.
Yeah, exactly. That's what I like. I think we're both very hungry when it comes to women's, physical health, emotional health. And how about starting off again with a little bit more education on what exactly are hormones? Like what, you hear about it all the time, but it's, yeah, let's just start there.
Sure. Well, the body has a variety of communication systems in order for information from the brain to get to the different organs, and then also within the organs themselves to actually control the cellular activities. So think of hormones as information delivery systems. Hormones can be delivered through what's called the endocrine system. That's where the hormone is made in a distant gland, like the pituitary gland or the ovaries and so forth. And then it travels around the body to different organs and different cells and delivers information so the cells know what to do. Every hormone will bind to a receptor, and that's essential. So you have to have the hormone and you have to have the receptor, and it has to be functioning so that it can then create this really important information. So it's a language. Hormones can also be produced directly within an organ. So that would be called paracrine. When the hormone is made in a distant organ, travels around in the blood to another organ, that's called endocrine. When it's made within an organ for use internally, that's called paracrine. And you can even have hormones made within a single cell for use in that cell to create information, and that's called intracrine. So you can see it's quite complex. And of course, in women, the ovaries are a very key endocrine organ. It makes testosterone, and the key one, estradiol, and its sidekick, progesterone. And then all those hormones get into the bloodstream, travel around the body to all the different organs. They all have receptors, they all latch on, and then information that's vital to cellular functioning is delivered. But as well, these different hormones can be made in specific organs, like in the brain. The brain can make all of those hormones, and in breast tissue, and in arteries, and in the GI tract. So many of these hormones are also made on site in a variety of different organs. And in fact, that's how men get estrogen. Men are loaded with estrogen, but they make it within each organ that needs it, specifically from its precursor, the androgens like testosterone, but it doesn't circulate. That's why if you get a blood level in men for estrogen, it would be very low. But there's actually plenty in the body. It's just not circulating. So hormones are not optional. I always say to have optimal health, you need to have optimal hormones. And it's not just having them, it's having them in the right quantity and in the right beautiful rhythms, because everything in the human body is based on rhythms. Nothing is static.
Lots of good things to tap in there. So how about if we talk about the organs that are most important for, in the female system for producing the sex hormones, let's say?
Well, in females, the key organ for making the so-called, I would call them so-called sex hormones, because originally, like estrogen in the form that the ovaries make, it's called estradiol, and progesterone, they were always considered sex hormones. And of course, in males, testosterone would be considered the main sex hormone. But now we know, we did not know this until relatively recently, that these hormones coordinate all the different activities in all the different organ systems so that you have successful reproduction. You can't just have a functioning of the reproductive organs sort of in isolation from the rest of the organ systems. Everything has to be perfectly coordinated. And these hormones have receptors and act on all the different organ systems in the body. That's why instead of calling them sex hormones, I should call them life hormones. They really are behind the actual sustaining of life, because everything in the body is about reproductive success. I know we spend most of our lives as humans trying to suppress reproduction, but in reality, we are the only creature on this planet that actually does that. Every other organ, every other organism, like any animal, they don't think about, oh, this isn't really a good year to have a baby. I think I want to go on birth control. No, of course not. Every animal in the wild, when there's the right season, they mate. If possible, if they can find someone to mate with, that's the way we all evolve. But humans try to, mess around with that. And understandably, because we don't all want to have babies on a perpetual basis. But on the other hand, by understanding, and we talked about that with birth control,
Yeah.
by understanding that reproduction is not a tacked on feature, it's actually, intimately interwoven with every organ system, and it's all one body. It's like when we used to think the brain was separated from the rest of the body, that there was like this giant barrier at the neck, and somehow everything that happened in the brain was distinctly different from the rest of the body. Of course, that's absurd. So if you don't have a healthy body, you're not going to have healthy reproductive functionality. And all of that requires optimal quantities and rhythms of female hormones, which of course is on a time clock. And ultimately, it's a timer, and the time's up. And that's something that every woman, I always talk about, back in the day, Benjamin Franklin was assigned this quote. I don't know if he came up with it, and this is paraphrasing it, that the only things that you can be sure of in life are death and taxes. That's because he was a guy. If he were a female, he would have said death, taxes, and menopause. Because if there's one thing a woman can count on, it is that she will go into menopause. Doesn't matter where she lives, what continent, what ethnicity, she will go through menopause, and there is no way out. So understanding what menopause really means to the female body, what hormones mean, what losing those ovarian hormones mean, and that it's so much more than the end of fertility and reproduction, because these hormones, like I said, are life hormones, not just sex hormones.
Okay, so let's talk about what's a natural. Well, we'll say what do you feel is sort of an acceptable, if there's such a word, natural range for perimenopause and and menopause?
Sure. Well, we have, in the United States, and every country has their own data because it's not exactly identical in every country.
Mm-hmm.
In the United States, the most common age for going into menopause is between 50 and 51. That now, the definition of menopause was set by healthcare professionals. So nature didn't come up with this diagnosis, like now you're in menopause, now you're not. But the official definition, which has a lot of arbitrariness to it, is 12 consecutive months without a spontaneous bleed. I can't even say period because we don't know that there's any ovulation involved, but it's just by definition 12 months consecutively and no bleeding, vaginal bleeding. So then voila, you're in menopause. Okay, but if we stop thinking of you've crossed the finish line, now you're there, now you're not, like, it's really a process of ovarian senescence or ovarian aging and decline. And it doesn't happen like one day you're perfect, one day it's gone. It's a process. That's why and in my book, I talk about stages, because it's better to think of it as sort of a process, and you have the transition, you have the perimenopause, the early menopause, the late menopause. And so once you say, okay, we'll just accept the definition for now, it's no period for 12 months or bleeding. So that's 50 to 51. So normal menopause by definition is 45 to 55. That's the decade. So any woman who goes through menopause in that decade is considered normal menopause. If it's earlier, between 40 up to 45, that's considered early menopause. If it's 55 or above 55, that would be late onset of menopause. If it's before age 40, that would be called premature onset of menopause. So, these are obviously to some degree arbitrary definitions, but it gives women sort of an idea. Now, if you say, well, menopause is no period for a year, no bleeding for a year, then if you say, well, what's the length of time that precedes that? Well, you could say it's the whole life, but you could also say, when does the accelerated aging sort of happen? It's during the preceding 10 years. So if you say, end all of your bleeding at age 45, that means that sort of, and this is a generalization, you entered the perimenopause around age 35. And if you had your last bleed at 50, then it would be, that you entered it around age 40 and so on. But, that's somewhat also arbitrary because we know that the decline in ovarian function is paralleled by the decline in fertility. And we certainly know that women, once they hit around 35 and older, have a huge decline in their ability to achieve pregnancy successfully.
Mm.
And it goes down from there. Once you get over 40, the successful pregnancy rate goes down. And when you hit 45, it just plummets. Even though women can still be, and some women are still having perfectly regular cycles, but their egg quality is down. The production of like progesterone is down. The ovulation is not as good. So things are definitely not the same at 35 as at 25, and much worse at 45, even in women who say, I feel fine. Things are changing. Ovarian hormones are declining.
Okay, so I'm glad you mentioned that. So I was going to ask, what are some, typical normal symptoms, that a woman might sense as they go down that trajectory that you just explained so well?
Well, the classic, of course, are the night sweats and hot flashes. And they're happening because estrogen helps control all the different functions in the brain. There are estrogen receptors through every single portion of the brain, including the area called the hypothalamus. And within the hypothalamus, there's a section of neurons that's called the thermoregulatory center. And as it sounds, thermoregulatory regulates your temperature, right? And the range becomes altered and it becomes inflamed. So a lot of things that are happening is when you don't have enough estrogen going into the brain, the brain becomes somewhat inflamed. We call that neuroinflammation. And that underlies a lot of neurological, neurocognitive, emotional problems. We now understand a lot of problems are really about inflammation in the brain. And so this is happening as estrogen levels are declining. So that's why we now recognize that night sweats and hot flashes can be interpreted on many levels. So it's miserable for women who experience them. It can be embarrassing, like you're having a professional presentation or you're in a meeting and suddenly you're drenched in sweat. It just, and your clothes are sticking to you and your hair is all like sobbing. So it's, very unpleasant, and you can't sleep at night because I have patients, they have to change their night clothes twice and their sheets are sopping wet. It's like they're sleeping in puddles, so of course it can be miserable, make you feel fatigued, and, you don't have energy, and, then, so that is very much on one level. But
that's very extreme, right?
Would you say that's the extreme, but I see it all the time. But so everything has a spectrum. Some women, about 80%, will have some symptoms of hot flashes and night sweats, but that still leaves about 20% that don't even have them at all. And they come in degrees from very mild, just a few now and again, to constant and disabling, really. So it's all the different spectrum. But what we now know is that when you have more severe and frequent night sweats and hot flashes, it's also a bad omen for the future, because women who experience the more severe versions have a higher risk of developing coronary artery disease, cardiovascular events like heart attacks, strokes, more likely to develop dementia. So we need to understand that these are symptoms that can be very unpleasant and alter quality of life, but they also are foretelling of risk. It's not destiny, it's risk. That's why, you need to, look at that. And we also know that women who are more prone to developing the worst night sweats and hot flashes tend to have more metabolic dysfunction when they enter menopause. For example, more obese women and pre-diabetic women, diabetic, just women who have unfortunately not been very healthy for a variety of reasons, and they hit menopause. And the way I look at it, you develop through your lifetime your health savings account. Just like for retirement, you want to have your savings for retirement. For women going into menopause, you want your health savings account so that when you hit menopause, you'll be that group that doesn't have night sweats and hot flashes, that doesn't suffer and actually can do really quite well for a long time. That doesn't mean that you don't age, but you age at a slower rate than women who enter menopause already kind of on a thin ice,
Right,
because they're
right.
not healthy, and this is like an added blow to their health status that their bodies really can't tolerate. So, and then another very common, and now this has been written about, and so this is definite, this isn't just like wives' tale, is brain fog and
Mm.
cognitive alterations, particularly word recall, like nouns. So it's a very, funny, but not sometimes sort of funny,
No.
or not, depends on how you look at it. So women can't remember names and nouns. So they'll have to go, but they're very good at adjectives and verbs. So it's like playing charades. It's like, what was that? You remember it was like this size, it was
Yeah.
this color, what was that
Yeah.
again? It's like, what is this? It's a game. I can't remember the name, or
That's
a person.
interesting. That's the first time
Yeah,
I've heard anybody, describe it like that. That it's mainly nouns.
it
Huh.
is. And I remember that when I was going through menopause, there was something in the news about Tiger Woods. I don't remember what it was. He was in the news a lot at that
Right,
time.
right.
And he's always in the news. He's in the news cycle. And I just couldn't remember his name. So I had to describe all the things he did. It's like, what was his name again? It's like, oh my goodness, Tiger Woods. So that's the kind of stuff that happens. And that's for real. I mean, that has been well documented. But other things happen that are not as well recognized, like palpitations. That's very, very
Mm.
common. Yeah. And, higher levels of anxiety, depression. In fact,
Hmm.
as you transition into menopause, the incidence of mood disorders doubles. And if you've had a previous history of mood disorders like postpartum depression, premenstrual syndrome, and such, other kinds of episodes of mood disorder, your risk quadruples when you go through the menopausal transition. And most people don't realize that, and they just slap, so many drugs on women, and they treat
Right.
women that, like they're crazy. And also estrogen, as it declines, it affects how the thyroid works, because
Mm.
thyroid hormone receptors require estrogen for the thyroid hormone to work properly. Remember, you need the hormone, but you need the functioning receptor. And we
Hmm.
know, like with insulin, like that's what happens in type 2 diabetes, the insulin receptor becomes resistant, like it doesn't work as well. And that's what happens to thyroid receptors as estrogen goes down. So even though the thyroid hormone levels can read totally normal on a blood test, women have a lot of the symptoms of low thyroid, and they go to Google and they say, I have that symptoms, I have that symptom. And then they go to the doctor and they say, look at all these symptoms, I must have low thyroid. And then the lab test shows, no, looks fine to me. And then the doctor thinks, oh, another crazy woman. But she's not crazy. You're making her crazy. What's the problem is that she doesn't have enough estrogen, and you're not recognizing that. So that's very much another problem. And then there's other things, of course, I mean, more wrinkling. The skin
Mm.
starts to get drier because estrogen affects all the different functions and layers of skin in terms of maintaining skin barrier and the resilience of the skin, the collagen in the skin, and
Hmm.
the fat that's under the skin to maintain it so it doesn't like wilt away and then create, hollows in the cheeks and wrinkles everywhere. And as well, what you call the skin appendages, like the hair follicle, like the sweat glands and the sebum. So all of those things start to change as well. So, women start to have hair thinning, their skin becomes drier, and they can even change like the scent that their skin makes, because the fatty acids are different, the microbes. Every organ in the body has a microbiome, its own unique population of bacteria and other microbes. And when all of these things start changing, like the fatty acids, like the sebum that comes out on the skin, and the liquids, and like the ceramides, all the protectants on the skin, they change. And what happens is the microbes on the skin change. So you have a different microbiome. And so when sweat comes out, they metabolize and alter the sweat, so it creates like a different scent. So
And that's true throughout the lifespan, right? I mean,
yeah.
even for an 18-year-old, yeah, through to But
That's right.
post-menopause?
Right.
Post-menopause as
When
well?
people go through puberty, their bodies develop different scents. That's
Right.
correct. But it's not very well recognized that women, after when they go through the menopausal transition, their bodies can produce different scents. Now, it's
Mhm.
interesting because people talk about with animals more than humans, but we know humans have it too. They're called pheromones. So
Yeah, yeah.
pheromones are like the sexual attractants. And when women, and this has been shown, that there are sexual attractants that are actually in sweat and scents that humans put out and that are not even appreciated. Like it's all subliminal. Like people don't realize that they're being attracted. They don't know this. But after menopause, nature sort of gets rid of that. So like I think that sometimes without there's no conscious awareness that men start to drift to other women when their wives go through menopause. They're not doing it on purpose. It's just that it's a built-in thing within the human body that
Interesting.
they're like it's like a little magnet thing that men are attracted to women who put out fertility scents, and we don't think about that humans are part of the animal kingdom and everything about life is about reproductive success. And that's why that's how it works in the animal world. And everyone knows it, that males and females are attracted, there's sense. But we see that in animals. The dogs are sniffing everything, and humans don't like run around with their noses, like acting
No.
like but it's a subliminal thing. It's not a conscious awareness. And humans are more complicated than dogs or lions and so on in terms of our thinking processes, but we still have those same underlying things that happen to us that are sent attractions.
Hmm.
So I think people should just know these things, and it's interesting when you think
Very
about that.
interesting.
And then everything kind of gets dry. Of course, the vagina gets dry, and
Hmm.
women can have sexual dysfunction and vaginal dryness while they're still having cycles because their hormone levels are declining. And
Hmm.
as well as skin, that because the vagina is really just a modified type of the skin, so everything sort of dries up, including your eyeballs. So women are very prone to what they call dry eyes as they
Hmm.
transition into menopause. And then
So
there's just, you can go on and on. That's why I have so many things in my book, because women just
exactly.
need to understand that so many of their symptoms are not randomness and they're not age like chronological numbers of years. It's really about loss of these vital hormones.
So what would you love to see, if you could just sort of do a whole new revamp of the medical system and how women should be treated in that sense, like in terms of, yeah, in terms of treatment. So like if we talked in the other episode about how we shouldn't use birth control to cover up the dysfunction, and let's say a woman's cycle might show up as. But how about someone who's 48, 49, coming now into your office with describing some of these symptoms? How would you approach it, and how would you love every physician to approach it?
Well, there's a certain amount of philosophy that goes into like what's your belief system as far as your views on aging, right?
Mm,
So,
mm.
I mean, menopause is universal for females. It's 100% natural. And some people feel, well, you know what? It's nature's path for women, and we shouldn't interfere with it. And we should accept it and embrace this new stage of life called, the menopausal years. And I have no argument with that for women who want to say, I don't want to be on hormones. There's certainly nothing natural about taking hormones after nature takes them away, right? So that's not natural. I would rather just work on doing other things like, lifestyle, which of course is an essential component for every stage of life, is eating the right foods, having fitness, working on stress, adequate sleep, reducing environmental chemical exposures. I mean, so lifestyle is always key, no matter what age you're at. And of course, when you get into more, we'll say, challenge times in life, like pregnancy is a challenging time for women. and menopause is a challenging time. You have to be even more diligent. Like you have less of a, we'll say, a cushion that you can like cheat with, right? You know, nature is not going to let you get away with as much. So you need to be more diligent. And women who want to take that approach, I will cheer them on, and I will give them also advice, which I give to everyone, you know, regardless of what path they choose, which is, you know, including a lot of phytoestrogens in their diet. And that's sort of nature's nice pass to women, that there are food on this planet that actually have ingredients. They're not hormones, they're not estrogen, but they're molecules that actually can attach to receptors for estrogen.
Do you want to
and
just
have
name a few of those
Sure.
right now?
Well,
Yeah.
the most famous one is soy. And you know, poor soy. I have to defend so many of the defenseless things like soy, because soy has been maligned and misunderstood. So soy is actually a fertility food. It has the ability to eradicate, or completely or nearly completely, hot flashes and night sweats. How amazing is that? In fact, there was a study published where if you fed women who had significant night sweats and hot flashes due to perimenopause, if you gave them a cup of soybeans every day, after 12 weeks, by the time 12 weeks ran around, virtually all the women had nearly or completely eradicated their night sweats and hot flashes. That's amazing, because yeah, isn't that amazing?
It is. And
yeah.
would you like, would soy milk and or tofu, like kind of that being more
Yes.
processed, is that still okay?
No, that's okay. So the
Okay.
soy that's allowed is either, you know, the soybean, or what you might call, like you said, lightly processed, which, and it should all be organic, because GMO soy is like 90% of soy out there. So you got to look at the label and make sure it truly, I mean, then we cross our fingers when it says organic that it is organic, but you know, I don't know what to do about all of that. But you know, you want to buy organic, because if it doesn't say organic, it's 100% not organic, and hopefully
Right.
it is.
Yeah.
But, so it would be soy milk, tofu, miso, and tempeh. Those are the only soy products that would be included in this. So it wouldn't be soy pretending to be turkey or ice cream or cheese or any, no.
Right. No.
So that soy is, it binds predominantly to the beta receptor. Estrogen has 3 different main types of receptors, and it can have a lot of benefit. And of course, it's a great source of protein as well. And so the polyphenols, that's, I call them the magic sauce of plant products. And in soy, they're called the isoflavones. And then they break down into genistein. There's a variety of them within that. And so they can have some really significant benefits. And I urge people to take it in the form of whole soy as opposed to a supplement. In fact, the supplements have not really borne out that they work so well. So there's something magical about the whole food. So, you know, just eat the whole food. And the other soy, the other phytoestrogen that is sort of famous is flax seeds. Now, flax seeds, I mentioned soy, that's isoflavones, that's the polyphenol. And when it comes to flaxseed, it's a different one. They're called lignans. So lignans are a different type of phytoestrogen. And so flaxseed is also very beneficial. So I recommend 2 tablespoons. So as much as you can, I mean, this is maybe not achievable, but it's a goal, right? 2 tablespoons of flaxseed and a cup of, you know, organic soy, if not every day, at least many days, especially if you're in that time of life, you know, transitioning. We know that with women from different Asian countries who eat a lot of soy starting in childhood, that seems to have a lifetime lowering of breast cancer. But if you just start eating it when you're already, you know, an adult, it doesn't seem to. It seems like it has to be from when you're a child, because it probably changes gene expression. The breasts go through many stages as you evolve through puberty and pregnancies and so forth. So it seems that to actually be a breast cancer preventative, you have to start it really early in life. But it has many other benefits, even if you weren't eating it when you were 4 years old. You know, wherever you are in life, there's still other benefits.
And I think this is, you know, why not experiment, right? Like if you're going through menopause and post-menopause, and if you try this, and what I like about flax as well as a fiber, so it can
Oh,
help
there's right.
rid.
Right. It's more than just one polyphenol. It's like there's so many other things that are part of the plant, the whole product.
The whole product,
So
yeah.
that's a very good way to approach menopause. But and some of us, but not all, like I said, will say, nature dished this out. It took away our ovarian function. I know it's natural, but so is death. And I don't want it. I want to at least put it off as long as possible. So I'm going to play nature at its own game, and I'm going to take identical to what the ovaries produce, so human bioidentical hormones, and think of it as a comparable to the following. If for some reason I had, say, a big benign tumor on my thyroid gland, and they had to do surgical removal of my whole thyroid gland, and now I'm fine, it wasn't cancer, I'm totally fine, but now I have no thyroid gland. So would any doctor say, well, you know what? It's okay, you don't have any more thyroid hormone in your body, but why don't you just meditate more? Or, like take up yoga or exercise, or, like eat more phyto,
right.
phytothyroid, whatever. So,
Right.
no one's, change your diet, but no one would say that if you had your thyroid gland removed. They'd say, okay, live a healthy lifestyle, but here's some thyroid hormone, right? They give you thyroid hormone.
Yeah.
So nature took away our ovarian function. It's totally natural, because once you accept that fertility, pregnancy, reproduction is the prime directive of life, and only humans are manipulating everything around so that we can do a lot more than just reproduce and raise our young. So once you accept that the body was designed for reproduction and doing it multiple times over and raising the kids to their sexual maturity, that when you reach a certain age, nature said, this woman is not going to be a good parent. She'll probably die in childbirth. She will not live long enough to raise the children to their sexual maturity. So we're not going to let her be a reproductive creature anymore. So it shuts down ovarian function, but the health of the woman is completely interconnected between reproduction and cardiovascular health, neurological health, gastrointestinal health. It's one body, and it kind of sinks or swims together. When you no longer are reproductive, you're no longer as metabolically healthy. That means your ability to control energy production, usage, storage, all of those vital functions that are essential if you're going to be reproductively successful. Whereas, you eat the right amount, you utilize energy right, all those things are not going to be functioning optimally. They don't completely go away, because we make estrogen, remember, in our individual organs. That's our saving grace, is that we still have some testosterone, we have still some androgens made by the adrenal, we still have some estrogen made in each of the organs that needs it, but at a much, much, much lower quantity. So we can live, but we don't live optimally. And, and a lot of that, how things go is based on our health savings when we hit menopause, our genetics, and our good fortune of where we live on the planet, and so forth. But I say, well, you know what? It is totally natural. Giving hormones after menopause is completely unnatural. I would be the first one to admit that. I'm trying to trick nature at its own game, because each of our cells in our body, they don't know how old you are. In fact, all the cells in your body are not the same age, because they die and get replaced at different rates. So the skin cells are not the same age as your heart cells or your bone cells. So they don't know. They're just genetically programmed to do what they're supposed to do. If you give them everything they need, they're still going to do their job the way they're genetically programmed. It's just that as we age, things don't come into the cell properly. We don't have the hormones, and then our gut doesn't work as well. The nutrients are not going to be as good. The mitochondria start to malfunction, and then we don't make energy as well. So I say, look, it's not natural, but everything we do in medicine to deal with the consequences of aging, they're not natural. So if we can actually prevent most of the conditions or delay them for a very long time that are associated with aging by giving human bioidentical hormones, I say, let's do it. Let's think about what happens in medicine that to people generally as they are aging. They have cataracts, so they take out the lens and put in a fake one. There's nothing natural about that.
No.
how about when teeth fall out and they put in implants? Nothing natural about that. Hearing aids, not natural. Stents in arteries. How about joint replacements? I mean,
Yeah.
how about plastic surgery? There's like we do so many things to counter the effects of aging on the body. None of them are natural. So what if we gave hormones and then our skin wrinkled less? Our joints worked better. Our bones didn't break. Our brains worked better. Our arteries and heart, So why not be proactive? And then the cost of healthcare for the country will plummet because people will stay healthier for much longer and people will live better quality lives. I don't know that if people will live longer. People are living plenty long right now, but they don't live very great lives.
Yeah.
Women live a few years longer than men statistically, but women have 2 to 3 times as much Alzheimer's disease.
Exactly.
Women make up the vast bulk of joint replacements. People don't realize that women have more joint replacements than men. Women have far more fractures. 80% of osteoporotic fractures occur in women. Women have at least twice the incidence of anxiety and depression. And after menopause, the incidence of breast cancer goes up, not because women have hormones, but because they don't have hormones. I mean, that's like absurdity. It's like losing your ovarian, losing your estrogen is associated with an increase in breast cancer. I mean, who has more breast cancer, 65-year-olds or 25-year-olds? It's like so wild, everything in the like colon cancer, which the colon has estrogen receptors throughout. Colon cancer dramatically increases after menopause. And not only that, the eye is part of the brain. And the brain, suffers after menopause. That's why women have word recall problems. They have 2 to 3 times the incidence of Alzheimer's. And women, because the brain and the eye are all connected, the eye is part of the brain. After menopause, there's an acceleration of macular degeneration and glaucoma. Those are estrogen related.
Like you're making so many more, like so many excellent points on, like, I love, it's not an argument, whether like you're for or you're not for, bioidentical hormone replacement. It's just simply fact. It's just simply what is. And I love the way you said, it's not about living longer. It's about enjoying life. And so much of that, you can argue as much as you want, but so much of that is like feeling good in your body and not, I don't know, trying to avoid mirrors, but when you're passing mirrors, you kind of want to look at yourself and say, hey, like I'm enjoying life. I look good. I want to run after my grandchildren. I want to travel the world, because when you think of it, like, let's hope that, after a certain age and stage of life, I mean, that's where a lot of women kind of feel, let's hope. Well, now I can start enjoying life more. I've done a lot of nurturing, as a mother, and now maybe it's a bit more time for me to, do what I really enjoy. So it would, it would be really unfortunate to say, well, no, sorry, Barbie, you're now like Beatrice and you're being put out to the pasture, after 50 or something like that. It's, I mean, that's really sad way of looking at women's health.
Well, yeah, I mean, we can, nowadays women can actually live half their lives in menopause. We want to make that a really wonderful half. My goal is that women can choose whatever path that they would like for that giant chunk of their lives, but they should do it with their eyes open. It's like you go to a menu, you wouldn't close your eyes and go, eeny, meeny, miny, mo, I'm going to eat this. You wouldn't do that. You would read the menu and make a choice, a thoughtful choice. I want to eat this. So that's how I look at it. When you hit menopause, you should know what your options are, and you should have your eyes wide open and then make the choice that's right for you.
And like you said too, it doesn't have to be it doesn't have to be so dogmatic either. Like maybe it's just like the phytoestrogen, foods. Maybe it's just supplementing with a DHEA in order, as a precursor to estrogen, for example, or testosterone. Um, like there's other ways. It doesn't have to be so severe or strict, like in terms of bioidentical hormones, but maybe it can be, for women. So what's your protocol then? Let's say personally I'm 54. Let's say I come in and I say, I'm I'm not sleeping as well. I'm waking up more now during the night. I lots of brain fog. I can't remember, the name of the person I met last week. I feel scattered. I'm feeling a little bit low. Hair is dry, skin is dry. What do you suggest for me? And so what would be the first thing you do? Would you use blood work? Would you use specialized, hormone test?
So, yeah, I do love data. So,
Yes.
I do love to get some initial laboratory and imaging studies, if as much as people can manage, afford, and so forth. So, I do a lot of extensive blood work because I want to know, like, what's our baseline. I want to know their thyroid function, if they have autoimmune conditions that are maybe, subtle, asymptomatic at this point, but at a risk for, like, she's going to have a higher risk of developing rheumatoid arthritis, which is quite prevalent after menopause. I want to know her inflammation markers because inflammation underlies virtually all the neurodegenerative, cardiovascular, you name it, musculoskeletal problems. It's all inflammation driven. And then I would like to know some of her nutrient status, like, B12 and omega-3, CoQ10, some, maybe zinc, copper, some of the nutrients. And I want to know a ferritin, like where's her iron level at, because so many women have very low iron. And of course, sometimes they have too high, but you want to know where they're at, because that's very, very important. So, I want to look at their lipids, and I would want to do a more advanced lipid profile that isn't just a standard one from like 70 years ago, but looks at what's happening with the cholesterol. Like, is it being manufactured in excessive amounts in the liver, or is the body like doing a great cleanup job? We call it reverse cholesterol.
See,
So, these are all
this
the
is
things that are
great.
important.
Like, I'm going to leave you continue, but sorry to interrupt it, but I think this is great because what you're saying here is that, again, the body is a system. Like, we're not just looking at hormones, we're looking at, iron levels and inflammation markers. Because again, this, as we said in the first episode, is your hormones are intricately connected to metabolic health. And you also, of course, that's why you wrote, the book on PCOS as well, to sort of, you know, um, educate women on all of that. So, but continue with the blood
Sure.
work.
So,
And
so that would be, and then of course I do get hormone levels because,
yeah,
obviously there is some, intuitive knowledge. If a woman says, I haven't had any bleeding for the last 3 years, and she's 54, it's a pretty safe assumption she's in menopause, but, to say the least. But most every woman likes to just see, well, what is my estrogen level? Sometimes you just have to show them, look, it's zero, so,
right.
so I want to know what their DHEAS is, from the adrenal. I want to know their testosterone, because that's a little bit separate. It's testosterone declines at a different rate. And sometimes after menopause, it actually jumps up for a while because of the stimulation from the pituitary hormone, luteinizing hormone, which produces more testosterone, which is the precursor to estrogen. But you don't make estrogen from the testosterone as well, and you end up with this surplus of testosterone and deficiency of estrogen. And that's why some of the women, as they're transitioning, they wonder, why am I growing a beard? Like, what's happening here? And they get suddenly acne in their late 40s. It's like, what's happening to me? I'm getting acne and facial hair. And it's this problem of over testosterone levels, high levels and low estrogen levels. So, you want to look at all of those things. And then if women are open to it, I'd like to get baseline imaging studies, and that would be looking at their arteries to look at the health. We can have with advanced vascular scans, looking at the carotid arteries, the leg arteries, the aorta. And I like to look at the heart with an ultrasound called an echocardiogram, because after loss of estrogen from the menopause, the women's hearts often have an energy deficient state, and it manifests visually on an ultrasound of the heart as what's called mild diastolic dysfunction. In other words, the heart does just two things. It contracts and it relaxes. So it pushes out the blood, it refills with blood. And the part where it pushes out the blood, that's systolic. That's like the higher of the two blood pressure readings. And that's what's usually watched completely in men. And if a man has heart failure, they say he has congestive heart failure, but it's really systolic. It's the contracting of the heart that's pushing the blood out that's not working well. But there's a different type of problem that occurs uniquely in women, where the relaxing stage of the heart, when it's opening back up and filling with blood, and that's the diastolic, or that's represented by the lower of the two blood pressure readings. And the heart becomes stiffer due to lack of energy, due to lack of estrogen, because estrogen promotes the function of the mitochondria that creates energy. So the heart actually has a mild energy deficiency state. And you can actually see it looks like a stiffer heart on an ultrasound of the heart when you're looking at it actually beating. And that's important to know if a woman has diastolic dysfunction, because that increases her risk over time of having problems involving her heart valves, in terms of having problems ultimately with even systolic or congestive heart failure, may put her at a higher risk for having rhythm problems or going into atrial fibrillation someday down the road. So we want to know what's the state of the heart. So I like to look at that. And then a bone density, just to see, because that's like your bone savings account. So if women spent most of their lives on birth control pills, or they had eating disorders, like, they were purging and they had or anorexia, so often, or they were like professional athletes or ballerinas, and they really had a problem with food, and they had a lot of restriction, or they had overexercise, and they really had lower estrogen production throughout their entire lives, then they will not have built up the same degree of bone quality and bone density. And so it's nice to know, well, as you're in the early stages of menopause, what are your bones like, basically, as far as the density? And so we know where we're starting from. If you just wait until you're like 60 or 65 and then you get your first bone density and it's low, well, did the woman lose bone, or did she never build bone? It's like looking at your savings account when you're 65 and the account is empty. You got like $1,000 in savings. That's it. Well, did you spend it all, or did you never put anything in? So you want to know where you start. Take stock of your assets, so to speak, your body assets. Like, what are your bones like? What's your cardiovascular system like? What's your inflammation systems? How are those going? So you want to look at as many of these different systems as we can to see where a woman is at. And then we know now that every woman, this is like universal, that goes through menopause is going to have not just an altered skin microbiome, mouth microbiome, but also a gut microbiome. And it's not altered to the benefit of the woman. It's what we would call dysbiotic. So it's not good. And so they get what's called impaired gut barrier or leaky gut. So every woman in the menopause has leaky gut. So the first thing I want to tackle is a gut rehab program. We call it the anti-inflammatory reset. So for a month, we're going to give an elimination diet, a real foods, whole foods diet, and supplements that help to support liver function, gut function. So that's where we would start. We also like to do body compositions in my office to see, well, what percentage muscle or fat are you? Like, what is you can't just know that by getting on a scale. And one of the things that happens, and every woman who goes through menopause has figured this one out, that her body shape morphs. It does. And what happens is she gets more belly fat, her waistline expands. She's just creating this expansive quantity of visceral inflammatory fat. And I didn't come up with these words, so don't blame me. I'm just the messenger. But after menopause, the women who are not on hormones or maybe don't have even optimal lifestyles, they fall into two camps. The women who are just, overweight and obese, and so you might call them the fats, and then the women who are thin, but they have low lean body mass, like their muscle is really limited. They're like really don't have enough muscle mass, and they often have low bone density, but they actually do have an excessive amount of visceral fat or fat around their internal organs. They may even have fatty liver, which is very common after menopause, non-alcoholic fatty liver disease, which is a really big metabolic dysfunction. And if you get like CAT scans of them, they have this excessive fat. So they've been labeled, remember, I didn't come up with this term, the skinny fats. So
Yes.
they're also, and in fact, women after menopause who develop diabetes and are really thin, they actually have a worse prognosis than the women who are significantly overweight and develop type 2 diabetes. So they're super thin women, they're really frail, and they have low body masses because they don't have enough muscle and bone. And then they have all that excessive fat, even though you look at them and they just look like they're skinny rails, but they really do have percentage-wise too much of this inflammatory visceral fat. And when they develop diabetes, it's actually more difficult to help them. And because you can't say lose weight, like you can, you can't do that. They're harder to manage and they tend to have worse outcomes. So, you can't just go by looking. That's why we like to do body compositions. We want to know, do you have a healthy percentage of lean body mass? That's really important. And then in my office, we do a fitness assessment because fitness is a vital sign. This came out in combination at least like a decade ago, in combination with the American College of Sports Medicine and the American Medical Association to declare officially fitness is a vital sign, just like blood pressure is a vital sign, pulse is a vital sign, temperature. So we want to know what's your, what is your fitness status? So we want to do all of these things. And, once I get a full view of where a woman is, then I can sit down with her and say, okay, here are your choices. These are all your blood tests. We'll go through, and, what would you like to do? And I'll explain. And I will always say, this is what I recommend. Just like you go to a restaurant and the waiter says, I recommend this. That doesn't mean you have to order it.
Right.
I don't order what the waiter recommends, but, I'll say, this is what I recommend, but you have to make the choice that's right for you. Nobody is forced to go on hormones, and I'll explain, what we can do. I can't turn the clock back. I can't stop the aging process. I'm just trying to slow it down and give people better quality lives so that they don't end up having lots of pharmaceuticals and lots of procedures done. And I want to allay suffering, right? I want to have people have better lives. So I'll give it all, my best to explain all the choices, and whatever the woman decides, I support her because, and I say, you know what, you can change your mind too. If you 2 months from now, you say, no, I do want to go on hormones, or you say, I changed my mind, I don't want to go on, you can change your mind.
Yeah.
So that's really how we do it in my practice. And then, and we work together and I follow people and, we work together. It's a team approach.
Yeah, nice. And I think, now I like the way you also touched on, and, it can be simply from the standpoint that I want to look better, but it's so much more than that though. When you talked about, the importance of fitness and the importance of nutrition, and just starting there can do, worlds of good for women, and how it's all related, to gut health. And it's just, again, it's not complicated, but in a sense it is, and because we are one big system, so we can't look at it in compartments either. And what was I going to say? Yeah, you can. So you're what you're saying is that, scans and all that, like the osteoporosis part is, I think, so important. And I want to just grab a couple tips from you in terms of supplementation when it comes to, like, do you believe in supplementation when it comes to osteoporosis and what we can do there? But also I wanted to ask, Hmm. Well, let's just go there because I'm thinking,
Well,
restless leg syndrome as well. Whether you come in with that complaint and do you feel that's related to hormone imbalance? But maybe you could just touch on both of those.
okay, so I'd love to sort of wrap it up with a few key supplements.
Yes.
That is a
Yes.
great
Yeah.
idea. So supplements always sort of they're accessories, right? They're
Mhm.
not the primary, they're the accessory item. But sometimes it's the accessories that make the woman, right? So we want to definitely incorporate them. So giving some about 500 milligrams of calcium. Vitamin D, I will dose according to what their levels are. It could be anywhere from 1,000 to 5,000 international units a day.
Mhm.
A good quality multivitamin, omega-3, a
Mhm.
probiotic. So these are like
Mhm.
I would call foundational, and
Mhm.
virtually everyone can benefit from those. And then I'm doing a lot of herbal work. So if someone has anxiety, stress, sleep problems, some of the favorites are ashwagandha
Mhm. Mhm.
for anxiety, bacopa. Those are two Ayurvedic or Indian herbals.
Mhm.
And then there's a lot of calmatives like lemon balm and passion flower,
Mhm. Holy
hops. Those
basil.
holy basil, also known as tulsi, is a
Mm.
wonderful one. And I use a lot of teas, so it
Mm.
doesn't seem as medicinal. And you can drink even like for anxiety, kava kava is
Mhm.
really tasty. And there's
Mhm.
just so many wonderful herbal teas that are calming.
Mhm.
And of course, green tea has been recognized for so many benefits, for
Mhm.
immune benefits. It helps with weight loss. So I do, and I love essential oils as well. And so they go through the limbic system, through scent and so forth, and they're
Mhm.
very effective in many different ways. And so there's many different herbals I'll use when there's mitochondrial dysfunction, like they're not burning fat properly. I'll add in ubiquinol, that's the absorbable version of CoQ10. Of course, if they
Mhm.
have iron problems, like they're anemic or they have low iron, I'll give an iron supplement, usually just every other day. We now
Mhm.
know that taking iron on an empty stomach every other day actually works better to get the levels up than every day because you're sort of flooding the receptors when you put them on iron too often. So those are, and then of course there's just a whole slew of additional things based on what lab tests show. Like if they have high cholesterol, then I might use something like plant stenols and bergamot.
Mhm.
If they have blood sugar problems, there's a whole bunch of things like
Yeah.
berberine, and there's chromium and cinnamon. So
Yeah.
that's in my world of integrative medicine, I have all the pharmaceuticals, the conventional pharmaceuticals
Yeah.
that everybody, blood pressure drugs and insulin sensitizers. So
Mm.
I'm very familiar with all of them. I know how to use them all. And then I have my more natural pharmacy, you might say. So
Mhm.
I use what's appropriate for each woman, giving her choices.
Mm.
And just lastly, about restless leg, I wish we knew more about restless leg.
Yeah.
We think
Yeah.
that it has to do with deficiencies at the brain level, maybe iron
Mm.
deficiency in the
Mm.
brain. I'll tell you, that's a
Mhm.
very common problem, and
Mm.
it is not simple.
Not
It's
simple.
not simple to fix that one, and it can happen at any age in a human's life, and it can be very, very disruptive. So I hope there'll
Mhm.
be more research on restless leg syndrome, but putting it
Mhm.
all together, and letting every woman make her own choices, presenting all
Mhm.
the reality of the picture, and the
Mhm.
choices, so every woman can steer the path into her second half of life in the direction she wants to go, so she can live optimally and happily ever after, right?
Right. And I mean, I was just going to say like this, there's so much information that we went through here and luckily you can, access all of that in through your books. So that's, a nice resource to go to. So strongly encourage everybody to do that. Do you have possibly just a few minutes to touch on? No, you don't. Okay. Okay. I forgot to ask about fasting. So,
Oh, let me come back. I could do a whole thing on fasting. That is like, honestly, that's an hour.
okay, well, perfect, because I think a lot of women are also very confused on that topic.
That's my
So
next book too. So that I am
wonderful.
I'm just starting to work on it. So this will be great. I would love to have a whole discussion on fasting.
Okay, in a couple months, I'll have you back again.
Okay, it's a
Okay.
deal.
Okay.
I'm going to go see my patients now.
Oh, yes. Okay. Okay. So thanks so much. And again, it was a pleasure.
Mine as well.
Okay. Goodbye.
Bye.
Mhm. Thanks once again for joining me on another great episode of I Think I Can podcast. If you liked it, please subscribe below so you don't miss out on any future episodes. And until next week, treat each day like it was your last, because each new day is a privilege that we shan't take for granted. Cheers and have a great week. Bye-bye.